dystonia is, of course, a hyperkinetic movement disorder. And the basis of my talk was really set out in a consensus paper published in Movement Disorders in 2013. And so the idea or the aim of this teaching course was to familiarize the audience with the new definition and the new classification system that the authors had proposed. And sort of briefly summarize, there are two axes, one based on clinical characteristics and one based on etiology. And the information of these can help to organize diagnostic thinking. I also touched base on recent developments in genetics of dystonia, and there have been several new genes which have been described in recent years, mainly using whole exome and whole genome sequencing. And for those who are not familiar with this, these are fairly new genetic methods that go beyond the traditional sequencing techniques and the sequencing of targeted genes. And so these methods can be used to identify new causes of disease. And in the context of dystonia, there have been several new genes now, including DYT24 up to DYT28. So they've been assigned a DYT locus. And they're mostly associated with autosomal dominant disease with variable phenotypes, including complex phenotypes due to mutations in the KMT2B gene or myoclonus combined with dystonia due to KCTD17 mutations. I also spent some time on discussing the other causes of myoclonus dystonia, where we have seen several new genes now which go beyond the typical cause of epsilon sarcoglycan gene mutations, and also mentioned the KCNN2 gene and some of the recent review papers that discuss the treatment for myoclonus dystonia. I also then discussed the other combined dystonias, including dystonia Parkinsonism and dystonia with ataxia. And there was an excellent talk in the same session about ataxia by my colleague, Dr. Pedroso. And I talked about some of the treatment approaches in dystonia.